Now talk to the OCTA Research. Joining us is Professor Guido. David. Good morning, Professor. Thank you once again for joining us. Now, when we last spoke, you were talking about the expected increase in cases in the coming days, and you said it would be between 5 and 6,000, and you were on the mark because we hit over 5,000. By tomorrow and Friday, how much do you think the number of cases will increase by? What are your projections?
Well, Ria, good morning. And yes, the increase is continuing rapidly, and not even tomorrow. Today, we're already expecting more than 10,000 cases. I think around 11,000, possibly around 8,000 of those in Metro Manila, compared to yesterday, where we had about I believe significant number, 3,800 cases.
All right, so that is a huge jump once again, around 8 to 10,000 new cases expected today. What does this mean then about Metro Manila's reproduction rate? Where is it now? And do you think that we will breach the highest recorded reproduction rate?
Technically, we've breached the highest reported reproduction rate because usually the reproduction rate is highest at the outset of the pandemic, when it goes from, a few cases to hundreds of cases. So it technically doesn't even count at the outset. So it's, technically speaking, we're at the highest reproduction number, where we're seeing more than 5. And during the Delta surge, it was only at around 2. And during the March surge last year, it was only around 2 as well. And it's also continuing to increase marginally in Metro Manila, but it's around 5 right now.
All right. What about the positivity rate? What are we looking at with this increase?
Yeah, well, I think yesterday we mentioned that positivity rate was around 34%. And but as of the latest, we're seeing a 40% positivity rate. And that is a major concern right now, the high positivity rate. It's the highest it's ever been. 34% was already the highest. Now it's a new high. And that means there's now a strain in the testing system of Metro Manila. I mean, of course, apart from the the hoarding that's happening with drugs, over-the-counter drugs and medicine. But now the testing system is strained because of a large number of people wanting to get tested. So we are, requesting our kababayans to, those who are requiring tests, some of them who may be feeling symptoms should probably assume that they already have the virus with the high number of transmissions that we're seeing right now.
All right. So does the country have the capacity to increase our testing capabilities? Or is it just going to be where it is right now and people will just have to deal with this situation of strained testing?
Well, I can't answer about whether the country has the capacity. I mean, I know that the RT-PCR testing is fairly limited in terms of capacity. We saw that during the surge last year, the Delta surge. But we can augment this with antigen testing. And in fact, that is what a lot of people are doing. It's cheaper. And during a surge situation, the antigen test is highly reliable. So I think that's what's being done. But, well, there are other concerns arising now because healthcare workers are also, going down with COVID. And also other people, officials, local workers. So I think it's not just the testing, but the manpower aspect as well.
Right. Which brings us to our next topic. Professor, what do you see in terms of the hospital bed occupancy rate? Yes, we know that many people are getting infected with the virus, including, as you said, healthcare workers. But do you see this translating into more congested hospitals and health facilities, given that the data right now points to milder symptoms?
Right. And that's the main criteria or indicator that we're watching closely right now. because as of the last time I checked the data, the healthcare's utilization was still below 30%. I'm sure it has moved above 30% already. So we are, seeing a lower number of, hospitalizations per, let's say, per 1,000 people getting COVID. Most of them are mild. But of course, if the base number of cases increases even more significantly, let's say there have been reports of cases going up to about 40,000, possibly, let's say 30 to 40,000 in the NCR. So because of the high base number that we might see, even with a low percentage of severe and critical cases, the healthcare system may also start to be strained at some point. So we are also, calling our kababayans who are feeling, mild symptoms, not necessarily to go to hospitals, but probably just get some bed rest. We know that some people are concerned if they get symptoms, they go to the hospital to get themselves checked. But if it's just mild symptoms, maybe they could just stay in a quarantine facility or get bed rest at home.
Okay, Professor, with the way things are going right now, when can we expect cases to go down? Is this something that could happen anytime soon?
Yeah, well, scientifically, there's really, we really have to plot out the trajectory of the pandemic right now. I mean, as it's going. But when we look at case studies, for example, in South Africa, the surge just happened 1 month. I mean, it started late November, and now the cases are decreasing already, first week of January. And it's actually a surprise, and it has surprised a lot of experts worldwide how fast the cases increase and how fast the cases decrease. Now, if we're going with that case study, the number of cases might actually start to decrease by the middle of January, and then towards the end of January, it could be already dwindling or something in Metro Manila, possibly in parts of the Calabarzon area. But that of course, factors in a lot of assumptions. And at this point, there's a lot of uncertainty and variability, and we're not certain right now if that's the case that will happen in our country. We're hoping it will be because of the high number of vaccinations, but it may the pandemic may prolong depending on how it's how it works out, how it plays out, and how it's managed.
Right. So here's hoping for a happy Valentine's. Thank you so much, OCTA Research Fellow Guido David.